and welcome to Candid Conversation Zoomed In and Comments video channel. I'm your host, Cliff. Today's topic is going to be a little bit of a tough one to deal with, but I hope that you'll find it interesting nonetheless. Since January 4th of this year, I've been a widower, and it has been an interesting journey to say the least, and one that has, of course, been met with many questions and reflection. One of the biggest is the question relating to a liver transplant for my wife, Darlene. Now, when we went through the process, of course, we asked and basically were denied that. It was a very sobering moment, realizing that we weren't able to and were not going to be able to get this done, which basically led, of course, to her death. When she died, I more or less had to figure out what the cause of death was, which was not very difficult to figure out with a bit of probing. With this in mind, I decided to dig in further and have not only found out what the cause of death was, but why a liver transplant was not possible. So, just to dive in here, as I mentioned, liver transplants are a life saving procedure for individuals suffering from end stage liver disease. However, despite the critical nature of the procedure, liver transplants are sometimes refused for various reasons. Gaining insight into the reason for a potential liver transplant denial is the focus of this comment today, as I mentioned before. Besides the wait time and the matching of a donor to a patient, there are other serious factors that can contribute to the decision not to proceed with a transplant. Medical factors also play a significant role in determining eligibility for liver transplants. Patients with certain medical conditions, such as advanced cancer or severe cardiovascular disease, may be deemed too high a risk for a transplant. Additionally, individuals with uncontrolled infections or inadequate social support may also be denied a transplant due to concerns about postoperative complications and long term outcomes. So I basically went around and I looked for different outlets to basically see what kind of information was out there. And I found medicine.net. It has a great article that basically illustrates the key reasons why a denial is going to take place for a person wanting to get a liver transplant. So here's that list that we're going to dive into. Age 65 years or older with some serious illnesses. If you have severe disease due to diabetes, or your loved one does, severe obesity, severe and active liver disease such as hepatitis B, you are currently on alcohol or drugs. So if you drink or you're using drugs, that's basically going to be a factor that will basically cause a denial. Have severe uncontrollable infections, so sepsis. That's one of the things that was actually part of the mix with regard to my wife, Dar. She had sepsis many times and was actually facing that even as she went terminal. So it was really tough to hear that and know that, but that's really something that was causing this and basically as part of the reason why the decline was there. Uh, you are diagnosed with aggressive cancers such as bile duct cancer, lymphomas, bone cancer, and melanoma. So any kind of these cancers are basically going to be something that, again, will block the request. With the failure of other organs apart from the liver, so your heart, your lungs, the kidneys, that was also a factor. Doris' kidneys actually no longer worked. Irreversible brain damage or disease. That is definitely a big one. This is probably going to be one that says, no, we're not going to do it. This is a trigger that's going to basically uh, shut that process down because it's pretty hard to comprehend if you have severe damage to your brain or disease to your brain to basically comprehend what's going on. Because of the Hippocratic Oath, doctors do not want to do harm. So if you have that kind of a condition, or your loved one has that kind of a condition, that's basically going to factor in, and more than likely it's going to stop the process. If you also have severe, untreatable lung, liver, and heart disease, that's basically going to factor in. If you have a diagnosis with a portal vein thrombosis, PVT is a vascular disease of the liver. It occurs when a blood clot occurs in the hepatic portal vein. That's a pretty big word. Hepatic portal vein. Remember that. Which can lead to increased pressure in the portal vein system and reduced blood supply to the liver. So basically, the liver is not getting as much blood as it needs. Hepatorenal syndrome, or RHS or HRS, this is a very, very nasty thing. This is actually also what's kicked in with our. It's a type of progressive kidney disease and failure with people who are facing severe liver damage, most often caused by cirrhosis of the liver and also a kidney stop. So basically, the kidneys are going to stop functioning, toxins begin to build in the body. Eventually, this leads to liver failure. So basically, the liver was failing. So again, this is something that's going to be there. And most notably about HRS, or syndrome, uh, hepatorenal syndrome, is the fact that a lot of people who get this are in the hospital already, and the mortality rate is above 70%. So you're not going to survive this if you're in there, or it's going to be a very low survival rate. You might get lucky. I've seen people who do that. Dar actually did it 3 other times before. She was able to come out of HRS, but the fourth time it was just too much. The body couldn't handle it anymore, and HRS set in along with sepsis and the failures of the kidney and the liver. Same time, basically, it was like a kaleidoscope of failures, or a cascade of failures in the body. So that's basically why they said no. So it's an important thing to recognize. If you have pulmonary hypertension, it is also going to basically affect the desire for the doctors to go forward with the process. It's a condition of increased blood pressure within the arteries of the lungs. Symptoms include shortness of breath, syncope, tiredness, chest pain, swelling of the lungs, and well, not lungs, but swelling of the legs, and a fast heartbeat. This condition is going to make it very difficult to do any kind of exercise. And finally, autoimmune disease. So Dara actually had that. She was facing autoimmune compromised system. So all of those things, if you look at this, if you have a lot of these things, or one of these things, or two or three, or there's a compound of these, in which basically that was the case with Darlene, it's basically going to be a straight up no. We can't do it because she's just not going to live. Then that's what they were telling me. She won't survive this. Even if we were able to go forward with it, it'd be a short lived experience for her. The other thing that's really important to note in this is financial consideration. It can also impact the decision to refuse a liver transplant. The cost of a liver transplant and the subsequent lifelong immunosuppressive therapy can be very expensive, so much so that it can be prohibitive. And patients and healthcare systems, in some cases, are just going to have a lot of trouble with this. Insurance coverage is probably not going to be there, or not fully extended to that. So basically, the cost associated with a liver transplant just going to be so inhibitive that making it unfeasible is going to be the case. And in certain individuals, to proceed with the procedure is just not going to be a go, simply because of the fact that, hey, look, you just don't have the financial wherewithal to do this. The other thing, too, that they note here, and I've seen this before, is psychosocial factors, such as a history of noncompliance with medical treatments or subsequent abuse of alcohol or drugs. So if you have substance abuse, or you're just not following the rules, it can also lead to the refusal of a liver transplant. Transplant centers definitely are going to evaluate you for psychosocial stability. They want to know that you're going to follow the rules, because this is a very, very serious procedure. You're taking somebody else's body part. A liver basically is the only organ that can regrow itself, it can regenerate. So you're taking it out of somebody's healthy body, or possibly a deceased person's body that has donated this, and they want to make sure that, hey, you're going to follow the rules. You're going to take the meds. You're going to eat right. You're going to do all the things that you're supposed to do. And if you're non-compliant, or they think you're going to be non-compliant, they're going to say no. So a potential recipient has to ensure that they will be able to adhere to the necessary treatments, the post-treat transplant care. Is going to require regimes that you'll have to basically go through. And if you cannot do this, then basically it's not going to be something that's going to work for you. So even for your loved one, if you're looking at this from a perspective of I want to help my loved one, if they're not compliant, if they're drinking or they have all these things and they're just not going to be compliant, or it's so so much cost to you, then basically they're going to say, well, we can't do this because it's not going to be feasible for you. You're going to be burdened with such high costs and non-compliance and more illness that's just going to more or less prolong the life short term. But the life of that person is going to end anyway because it's just going to recycle back. So you can't keep putting livers in people. It's, that's not the idea here. It's one liver. Let's try and see make this work. But if it doesn't, or it's not going to, they're going to say no. In conclusion, the decision to refuse a liver transplant is a complex and multifaceted thing that they're going to look at. It involves various medical, financial, psychosocial, and ethical considerations, and facing a denial or a pushback from a doctor with regard to a transplant can be very, very challenging. Um, Exploring all the available options, it's going to be a difficult process, but it's a situation that you want to take on with resilience and determination, and that comes from engaging with people. Just basically know that there are resources that you can reach out to in the medical field as well as other advocacy groups that can talk to this and help you through it. So don't be afraid to reach out to them. My only real true suggestion is just to basically do more research and become better acquainted with what a liver transplant is all about and what can basically affect its success or failure, whether it be from all the things that we've talked about already, things that have not even been mentioned here in this video. You need to basically do your research. And again, best of luck in every situation that you might be facing with regard to this. And I really appreciate your visit to our website and channel. Please subscribe, like, and share the videos. I really appreciate that a lot. And we'll see you in the next video. My name again is Cliff, and you've been watching a video comment on liver transplants right here on Candid Conversations, Zoomed In and Comments video channel. I'll see you in the next episode. Bye-bye.